It comes like this, isn't it? It comes in the OT position, occipital transverse position, normally. Because the transverse diameter is more. So whenever the diameter is more, the baby try to come through that diameter rather than turning and coming. Okay. So in the mid cavity, what happens? It is same. Mid cavity, AP and transverse both same. Okay. On the other hand, lower cavity, what happens? AP is more, transverse is less. So it will try to accommodate the more diameter one. That is the AP. Okay. So it turns like this and comes anterior. So this is the normal general, the commonest presentation and delivery. So it is occipital anterior position. It can be the left side or it can be the right side depending on the baby's life. If it is the left side, it's left side. If it is the right side, it's the. So now the normal delivery steps. What are the steps in the vaginal delivery? First, what happens? Baby lies like this, and it comes like this. What is when it comes inside this inlet? What is called engagement? It engage first. Okay, it engaging, and then what happened? Descend. After the inlet, it comes down. No, to come to the outlet, it descends, and then what happened? It descends. At the mid cavity level, it descends. And what happens?
Rotation.
The descent is the one we are seeing with the station. Descent is the one we are seeing with the station. Okay. So now it descended. And then what happened? It has to come to the anterior one. So what happened? Inside the pelvis, it starts to rotate. OT to OA. So what is that called? Internal rotation. Internal rotation. And then what happens? It has come to the AP diameter. AP diameter, it has to accommodate the AP diameter. So in order to that, baby has some kind of modification in changing its diameter. So for that, it has to flex. So there will be flexion. Then only the vertex is visible with the flexion. Okay. So what is the diameter is called for the vertex presentation? Nose. Okay, I will come back to that later. Okay, now it has flexed. And then what happens? Flexed. And then crowning. Have you heard crowning? It has to slowly come out through the introitus. So that is called crowning. With the crowning only, we attempt the episiotomy in order to facilitate. Okay, so crowning, and we do give the episiotomy. And then what happens? It extends. Extends. So extend to Nama, what happens? It tries to turn on its own. That is called external rotation. So and facing the mother's tummy. So the baby is like this. So now I told you, no, it has come like this. Think about the body. Now it has come like this in the transverse position. Then it internally rotates. So this body also rotates internally, and then it has come, extension and come, and what happens? It rotates, head is rotating, but the body remains same because here the shoulders touch. Okay, and the body doesn't rotate, and only the head rotates and seeing mother's thigh. Okay, so what happens? Then the body has to rotate. What is that called? Restitution. Body rotates and the head and body in the parallel. So when the body rotates, what happens? The shoulder comes anterior-posterior, isn't it? So then what happens? Delivery of the posterior. Okay, and then delivery of the anterior and complete delivery. These are the steps of vaginal delivery.